Okay, we're live.
Good afternoon, everyone. Welcome to Alvernia Live Chat. We're now live across Instagram, Facebook, and TikTok. I am Dr. Lim Wei Shyan. I'm a psychiatrist at Mount Alvernia Hospital at our Alvernia Psychological Health Centre. So I'm really glad you've taken some time out to join us over lunch today. I'll be happy to take questions that come in. Right, so today, our topic is this stress or a sign of mental illness, and also knowing when to seek help. So if you have any questions, please do feel free to leave questions in the chat function. I'll do my best to get to the questions today. Okay, I think we have some questions that have already come in. Right, so I'll just start addressing them first. Okay, so these questions came from Instagram. First question, I have a friend who pulls out his own hair whenever he's stressed. Is this something to be concerned about? Alright. Again, we don't have a lot of detail here, but I suppose we will probably start by considering if it is quite clear that the hair pulling is in response to stress, then quite clearly this may not be the best way of coping with stress. And certainly I think there's a reason for you to maybe suggest to your friend that maybe get some help and figure out what other ways there are to deal with this stress. And I think of greater concern might be if besides the pulling hair, there are other manifestations or maladaptive reactions to stress. So for instance, if the friend is getting so stressed that he's not sleeping well, he's not eating well, or if there are other manifestations like he has lost his interest in work, in hobbies, then certainly I think these are all red flags and you might want to encourage your friend to speak to somebody. Okay, while waiting for more questions, I think I'll move on to the next one that's come in. If someone keeps saying I'm just stressed, but the feeling never seems to go away, when should they consider seeking professional help, and is it expensive? So it seems like probably the two questions. I'll handle the first one first. If somebody keeps saying I'm just stressed, but the feeling never goes away, I would say that if from your observations the stress is proportionate, this person that you're concerned about is still generally functioning day to day, then probably we may not need to rush the person to seek professional help. But if the stress has spilled over to, for instance, if this is work stress, this is school stress, but the stress has spilled over to personal life, as I mentioned earlier for the previous question, if there are physical functioning difficulties, not sleeping or eating, or if there are some psychological complications as well, the person starts to feel very beaten down, then I think it will be time to actually suggest that your friend or the person you're concerned about seek professional help. Is it expensive? So I suppose in terms of the mental health field, we do have various options, right? So in terms of professionals, you have psychiatrists, you have psychologists, you have counselors, and also in terms of help-seeking avenues, in Singapore we do have public sector providers, we have private sector providers. So the cost of seeking help can vary depending on the profession you go to, as well as also whether you go to a public provider or a private sector provider. Now, so I would say in this context, if really there are not a lot of red flag signals yet, I think approaching even a family doctor, approaching a counsellor, this would probably be quite cost effective. And depending on what transpires after the initial exploration, you can then decide what other options you may want to seek. I think also on the note, I just wanted to share that, as I mentioned, there are a lot of mental health professionals in the field, and we tend to very commonly think that, oh, if I have to see a mental health professional, it is a mental illness or I have some mental health reflex. But I think this is this conception that's quite pervasive, at least locally. I just want to take the opportunity to also share that, unfortunately or fortunately for psychiatrists, really, when you do see one, we are concerned and we're rather focused on picking out illnesses. But my colleagues who practice counseling or psychotherapy, psychologists, they're actually very well placed to help with a variety of issues. So you don't really have to seek out one only because you think there's a mental illness going on. If you're grappling with some life stresses, I think counselors and psychologists are also very well placed to help with these issues.
Would you be on the, can you go to the first step?
Okay, so we have a new question coming in from TikTok. My friend doesn't believe in mental illness. He says it's just stress. How do I explain to him that it can be a real medical condition? I think there's a distinction between stress and when stress crosses over to a situation where we're concerned about medical condition. So as I alluded to, stress is very much part and parcel of life. But I guess the line we cross when stress becomes maybe a mental health concern would be if instead of managing stress and coping with stress basically invades other areas of life and then causes a lot of functioning difficulties for us. So if your friend has already manifested, or rather the person you're concerned about has actually already manifested other symptoms like constantly feeling down, not being able to motivate herself to cope with day-to-day demands, then that's when you may want to point out to your friend that, look, normally under usual stress conditions, we tend not to get so beaten down. If there's more happening, then perhaps we could be dealing with something that's rather more medical in origin, and best to get it checked out. Okay, I'm being prompted about the new question. Right. Okay, new question. Do I need to seek help if I still cry, feel depressed at times over the loss of my family member who has passed on many years ago, or is this normal? So this is a question about grief. Generally speaking, we do recognize grief as a normal phenomenon. When somebody very dear to us is no longer with us, sometimes the pain can reverberate for a long while. There's this notion of a prolonged grief or complex grief. The challenge is that really, if you think about it, it's actually very, very difficult for us to put a marker to when prolonged grief is unusual. I would say that if years down, the intensity of that pain of loss is still very significant. If each time you feel very sad or low about the loss, you find yourself not really functioning very well. You can't bring yourself to go to school, can't bring yourself to go to work, then it's best to actually speak to somebody professional about this, and then we'll do a more thorough evaluation to figure out whether there's something else going on. For instance, there could actually be depression that has developed after the initial grief. Right, so the questions are coming in. How do we help friends with generalized anxiety disorder? Well, this is a very brief question, and unfortunately the answers will probably take longer than this live chat allows. I would say for a start, I mean the context is how do we help friends, so we're not talking about how medically will help persons with generalized anxiety disorder. I mean, if you suspect your friend may have a generalized anxiety disorder, I guess first and foremost, I would just start by reflecting some of my observations with my friends and why I think it could be a condition that deserves a lot more evaluation, right? I think a lot of people in Singapore, they're still very mindful. If I go and see a mental professional, I get a diagnosis, would that be a problem? I think first and foremost, if we want to find out a little bit more, I think we want to reflect what we observe, and then if really there's something to it, if let's say your friend also shares that he or she has been very, very distressed, has been very much affected by symptoms, by their troubles, then I guess the first step is we can, again, as with previous responses earlier, encourage that they talk to a professional. And again, this does not necessarily be a psychiatrist, because usually I think people find it most difficult to see a psychiatrist for fear of being diagnosed or labeled. I think it's actually fair to also think about consulting with general practitioner. These days, actually, our general practitioners and primary care physicians, they're actually very well trained also in mental health issues. So as an initial screen, and if really there are, basically if the initial evaluation turns up more areas of concern and the first responder feels like there's a need for further evaluation, you can leave it to the healthcare provider to then basically do the necessary in terms of referring. Okay. Right, the question coming in, this is a question I actually get quite a lot, even in usual clinic consults. What's the difference between a psychiatrist, psychologist, and counselor? Alright, so again, I cannot claim to have the most rigorous or 100% perfect answer, but the way I delineate the roles will be like this. I think the easier distinction between psychiatrists and the other professionals. Right, so as a psychiatrist, we are medically trained, so we're medically trained first, and after basic medical training, we pursue an area of specialization that looks more at mental health rather than a specific organ or specific physical conditions. In terms of what we do, and this is probably more unique to Singapore than can be generalized to other parts of the world, but in Singapore, psychiatrists tend to focus a lot more on diagnosis. It basically relates to our training. We need to be very familiar with illnesses. So in terms of diagnosis, most people would then say either you've got to confirm this or get some kind of a certification from psychiatrists that you do suffer from this or that condition. And also in terms of interventions, the majority of us actually then end up using medications because of how we are trained. Although I have to qualify that by saying that we have some psychiatrists in Singapore who have very, very deep grounding in psychotherapy, so they actually do psychotherapy as well. So then that takes me to psychologists. Psychologists is actually very, very general. If you're familiar with the psychology undergrad program, there are actually a lot of different psychology subspecialties. We have occupational psychologists, we have educational psychologists, social psychologists, academic psychologists. I guess what we're talking about here is a clinical psychologist. Right, so a clinical psychologist is basically from day one of training, they train in psychology. They don't go to medical school, they don't go through the basic medical training. But after the basic psychology degree, most of them go on to actually get a further degree. Typically minimum a master's degree in clinical psychology. Some even have clinical doctorates. So essentially they render what simplistically we call talk therapy. Simplistic because psychotherapy is a lot more than that. But they are really the experts at psychotherapeutic work. Typically a clinical psychologist in Singapore would have had not just a postgraduate education, but would have served in a government institution, whether it's a hospital or some agencies in MSF, and they work between 5 to 10 years gaining the clinical experience. So as I mentioned earlier, whereas most people will associate seeing a psychiatrist with basically clarifying whether there's an illness condition or looking to medication treatment, people can see psychologists for non-pathological conditions as well. So if you're going through a rough patch, I want some therapeutic work for instance, for some relationship difficulty, I may not need to have a mental illness, I can also see a psychologist for that. Last but not least, counselors. Counselors are rather more diverse groups. So we have counselors who are more generic in nature, and they are very comfortable, also experienced in dealing with a broad range of topics, issues. So some of these counselors you can find at places like family service centers, or we have specialized counselors. So we have counselors who specialize in grief, in relationship issues. So they are a much more diverse group. Generally, when I recommend either professional to a patient, usually the decision would be, or rather the decision will be built on considering whether I think the issue is more external or intrinsic. So if let's say there has been an external problem, for instance, academic difficulties, for instance, relationship problems, I may think about counselling more, because essentially counselors, a counselor's lens, if I can loosely just characterize this way, focuses on problem solving. Right? Whereas for a clinical psychologist, usually the starting point is we can't control things that happen to us, but how we respond to the situation makes a world of difference in the way we cope. So the psychologist tends to be more inward-looking and will be focused on looking at how to modify nudge a person's perspectives so that they can cope better with whatever situation that cannot be changed very much. Sorry, that was a very long answer, so because it's one of those things I find myself explaining a lot. My friends say, okay, sorry, this is a new question. My friends say that being on antidepressants made him fat and have no emotions. Are there antidepressants that don't have such side effects? Okay, so I think I'll address the weight gain part first. Yes, certainly, actually the majority of antidepressants do not cause weight gain. We do have one or two that potentially can cause weight gain. If weight gain is a concern for you, and in fact most of my colleagues will be very cognizant, if the profile of a patient is of a certain profile such that we know that they would be very sensitive about weight gain, then we would already preemptively avoid such medications. As for the no emotions, it's a little bit trickier. So antidepressants, a lot of people may believe that antidepressants are happy pills. It's a very common kind of a notion out there. If I take antidepressants, I will stop feeling sad, I'll feel happy. But really how antidepressants work is that they limit the extent to which people feel sad or low. Hence they're called antidepressants and not called happy pills. They chop off the very low moods in depression. So this is why there are patients who, after taking antidepressants, initially may feel that their emotions are a bit blunted. They may compare to pre-medication. Oh, this happened. For instance, I had this misunderstanding with a friend. Normally I feel 8 out of 10 in terms of feeling low. But right now, because of medication, I feel like I can go beyond a 5 out of 10 in terms of depressed state. And so people may feel like, oh, my emotions are stuck, very blunted. There are newer medications that don't have this emotional blunting, so that option is also available. Right, so we have been on the live chat for a while. I just been prompted that there are new joiners. So shout out, good afternoon, hi to the new joiners. For those of you who just joined us, I'm Dr. Lim Wei Shyan. I'm a psychiatrist at Mount Alvernia Hospital. And today we are taking questions over this live chat. So if you haven't left any questions, you're burning questions, do feel free to also pop a question to us. Okay, this is a tricky question. I will attempt to take it and try not to get flamed. My colleague always used stress to take leave from work. How to tell if someone is not mentally ill? I shall not comment about your colleague. I will not comment about, because I mean literally I can't comment about specific situations and why your colleague takes leave. But I can answer the next question, which is how to tell if somebody is not mentally ill. So I can do it in a short manner or do it in a long manner, but I'll do it in a slightly long manner. Right, so very often I think what we do tend to explain to patients who come and seek consults is that very uniquely to mental health, you realize there are a lot of symptoms. You can look up diagnostic criteria on the web on that, and you realize a lot of symptoms associated with mental illnesses are actually also part and parcel of our experience. So for instance, feeling sad, feeling depressed. Yes, sure, people with depression, they feel sad, they feel depressed, but does that mean that people with no depression never feel sad or depressed? We all intuitively know that's not true. Likewise for anxiety, we do feel anxious from time to time, but does that mean that we all have anxiety disorders? Also quite a clear resounding no. So normally when we make a determination about whether something is a mental illness, we don't just look at specific symptoms, because they can occur also in normal experiences. So a few things we look out for to determine whether there's a mental illness. First, a congregation of highly related symptoms that will point to a diagnosis. What do I mean by that? So for instance, if I'm just feeling a little bit blue, a bit sad because maybe something didn't go well at work last week, but if at the same time, I also experience a lot of functioning difficulties, I can't bring myself to work anymore, I find myself crying a lot, I'm so bothered to the point that I can't eat, I can't sleep very well, or I harbor thoughts of wanting to even hurt myself, I'm that sad and depressed, then it could point to potentially an illness. So essentially a collection of highly related symptoms rather than isolated symptoms. That's one way we decide whether somebody comes in with mental illness or not. The other thing we look out for is across the duration of symptoms manifesting, normally do we see a direct cause or a clear cause for that? So for instance, if maybe over the last 2 years somebody has been feeling down a lot, but maybe the person's situation over the last 2 years have also been very, very difficult. There's a chronic issue that's not resolved, or there may be repeated problems that continue to bother and stress this person. Then we may think of it as maybe less of a depressive illness or less pathological condition, compared to somebody whose life has been, for lack of a better descriptor, relatively peaceful, and still the moods crash, or anxiety arises over situations where most of us will not feel naturally anxious about. So that's the other kind of telltale sign we look out for. Okay, I shall not go on that because there's another new question now. Are antidepressants easy to stop or to go off? When do people know when to stop the medication? Most antidepressants are not difficult to wean off, primarily because antidepressants, again, this is a big misconception or myth I hear. Most antidepressants don't cause dependence. There are certain medications that can cause dependence. Those medications will be very difficult to wean off, but antidepressants generally do not belong to that class. The tricky part about antidepressants is that we do know they work. So what happens is that typically after 4 to 6 weeks of taking a certain medication, we adjust it to the right dose. Most patients do feel better. Now the challenge is if, let's say, a lot of patients decide, oh, I feel better now, let me go off medications. What happens is, at least in the initial 4 to 6 weeks before circumstances change for the better, it is largely the medications doing the heavy lifting and making the person feel better. So going off medications prematurely then can cause symptoms to re-manifest because you are basically taking away whatever support there has been. So this is where people feel like, oh, I can't stop medications, I'm very dependent on them because once I go off, my mood starts to be terrible because my anxiety comes back again. This is why we have this notion of a maintenance phase. After things are better, we keep medications on for a while. In the meantime, we continue to work on whatever has been driving the anxiety, the depression. And when these other interventions have been implemented, we start to tail off the medication. Most patients actually go off medications quite successfully. When do people know when to stop? Well, who does people refer to? Usually it's a collaborative process. So when I saw the term people, I'm just wondering whether you're talking about the patients, the next of kin, or the medical provider. Generally speaking, usually it's a collaborative process. Sometime after we have maintained a patient well, we start to, usually about 2-3 months, 3-4 months, depending on circumstances, we may then propose to the patient, or patient may bring it up first, say, hey, the doctor, when can I stop medication? And usually we want to consider factors like whatever was driving the initial depression, has that been largely resolved? Looking forward, in the next 1 to 2 months as we tail off medications, do we expect any kind of crosswinds, any stressful situations? Now, if the coast is clear in that regard, that's when we start to tail down, and that's when we know we can start to bring down and stop medication. Okay, there's a new question. Can chronic physical pain lead to depression? Short answer, quite certainly yes. Imagine you are living with pain that comes up day after day after day, and you're very helpless. It is limiting basically everything you need to do and you want to do. With time, it can lead to depression. Does it definitely lead to depression? I can't say so, but it can. We have patients who come in to us with chronic pain situations that have not resolved, and it starts to wear them down, and depression develops. Okay, I've just been informed that we have just 5 minutes left. I can take 4 more questions, so if you have further questions, please feel free to leave your comments. And quite quickly a new question that's come in. Triggers leading to loss of temper, personal control and resentment. Is this anger mismanagement or mental issue? Again, very short details, and I don't expect a lot of details coming in obviously through Instagram. But I would say if to the observer who knows a person experiencing these difficulties, this is highly untypical or disproportionate, right? So loss of temper, for instance, if something very trivial has resulted in this person essentially throwing furniture, basically ranting very loudly and inappropriately, and this is not in keeping with the person's character, then I would say we may be looking at not just potentially mental issue, but depending on the age group, it can even be a brain issue. So if it's uncharacteristic, if it's disproportionate, definitely we want to evaluate, we need to assess to see whether there's something else going on. If we're talking about anger mismanagement, we tend to think of it as rather more chronic, meaning this is not something that is acute or not new. It has been basically a feature of this person for a while. It's just that the intensity or the extent can vary from episode to episode, incident to incident. Okay, we have a question that's very specific about our service here. Do we only see juvenile patients? I suppose juvenile means child adolescents. No. At Alvernia Psychological Health Centre, our spectrum is actually very broad. We are comfortable seeing a range of patients of different age groups, from, I would say, primary school children all the way to even the more elder folk. I personally also serve at nursing homes, and I have also seen elder patients before, so I'm comfortable taking up to, I can't say an age limit, but as long as people can speak and give an account, I think we can happily see. And as for conditions, it is really more determined by the support services. So for instance, for substance use for now, because usually it requires a very specialized team of counsellors, therapists, and even social workers to deal with the associated issues around substance use, and we haven't quite composed a team yet, so for now we are not able to take on such cases. However, for mood conditions, for neurodivergent conditions, for anxiety, psychosis, a whole range, you can find out more on our website actually. We have a list of conditions that we can assist with. Okay. We have probably time for last two questions, and the big questions. Okay, the first big question: what are the side effects of antidepressants? This is literally probably one or two lectures in medical school. But I'll maybe just scope it out by saying that these days when we talk about antidepressants, we mostly use this class called the SSRIs. I shall not attempt to spell out SSRIs, but we tend to go by SSRIs. And the side effects would, as a class, we think of, the most obvious one that I tend to brief upfront our patients is that look out for allergy. This applies for not just antidepressants, but any new medication you start. Otherwise, as a class level, SSRIs tend to be associated with digestive side effects. They tend not to be serious. Most of the time they manifest as bloatedness. Sometimes if it's a bit more serious, there can be tummy pain, there can be nausea. Other than that, as a class, we also tend to observe that some patients would come in, they may complain of some sexual side effects, generally a decline in libido, but this is heavily confounded by the condition we're treating for anyway. So for instance, sometimes we can't really tell whether it is the underlying depressive illness, anxiety condition that has caused a loss in libido, or is the medication, at least until we bring the underlying condition under control. Then sometimes we also think about antidepressant SSRIs, potentially in somebody who's already vulnerable. For instance, there's a kidney issue or any other medical condition causing a tendency towards low sodium. Sometimes antidepressants SSRIs can tip people a little bit more into low sodium situations. And sometimes minority, very rare cases can cause difficulties in blood clotting. But again, more prominent if there's already underlying blood clotting problem. Then among the antidepressants, there are also some side effects specific to each one. So for instance, there was an earlier question about antidepressants making people put on weight. There are some antidepressants that make people feel sleepier, but these are not generally the case for all SSRIs, only specific medications. Okay, I think this is the final question. Doctor, I always have overthinking and anxiety of getting terminal illness. What should I do? I guess my first question is probably we need to verify whether it is overthinking, excessive anxiety, or you have reason to worry. I think that's my starting point. Obviously, if there are already certain symptoms and you know or you've read up and you think that these symptoms could be red flag warnings for terminal illness, I'll say for peace of mind, get some checked. But I guess if overthinking refers to the fact that you have done your screening, your family doctor or your specialist has assured you, no, you're in the peak of health, there's no problem, and you constantly overthink, then we may need to explore a little bit more what drives this anxiety in spite of more objective information and evidence that you do not have a terminal illness, right? Because in this question you're referring to yourself, then I'll address you as yourself also. I mean, if you're open to maybe having a chat, because these things probably you would need a bit of exploration, right? I would say a starting point could be a psychologist. If you don't mind seeing a psychiatrist, you can start a psychiatrist as well. Essentially, the approach would be we'll try to figure out whether there's something in your experience that have contributed to you magnifying this worry about terminal illness, even though in your specific situation the odds are very, very low. It could come from a place where we've seen situations where there is strong family history, or there are loved ones who have been lost to terminal illness, and sometimes it could be a manifestation of things like grief. So it may not be just overthinking anxiety. You probably definitely need to address this and explore a little bit more. Okay, so I'm quite relieved that the live chat has come to an end. Thanks for joining us today. Okay, I was just kidding. I mean, as the live chat on, I did feel that it was quite a bit of fun answering questions from you. In case, I'm supposed to let you know, in case you missed any segment today, we'll share some snippets of our video on social media. So I'm not going to do the click to follow. But yes, you can look us up on our social media pages, and if you have further questions, you can also reach out through that avenue, and then we'll try to come back to you with the answers.
Alright. Okay, we're ending. Thank you.
Bye.